Let's bring in Adam Hancock, who joins us live from Singapore for more. Adam, what have Chinese officials done differently this time around in releasing their information that has caused this dramatic spike in infections?
Well, I think they finally gave more of a detailed insight, really, into exactly how devastating this wave of COVID has been since they decided to drop those zero COVID restrictions at the end of last year. They've also now reported a number of deaths which are linked to COVID. So they have very different definitions of COVID deaths compared to most of the world. But of this 60,000 COVID-related deaths, they're saying around 5,500 are people who have died from respiratory failure directly caused by the virus. And then the other 54 or so thousand, they're saying they are people who had other underlying health conditions, but also had COVID and sadly passed away. So they have decided to add that number in, which is the first time they've done that. And remember, there's been plenty of criticism about the way that China has been defining COVID deaths and reporting them, including the World Health Organization, who said that their definition was far too narrow of what a COVID death is. China has also released some new data on exactly who is dying in this wave of infection. It looks like the average age of deaths is 80 years old, and the majority of people who are dying are suffering from other underlying health conditions, and the overall majority are all over the age of 65. So the data is actually very similar to what we have seen in other parts of the world. It's mainly affecting older people, elderly people, and people with other underlying health conditions. But the World Health Organization, whilst being happy at the data that has come out, they do want more information. And considering that China was reporting 5 or fewer deaths a day since these restrictions changed, and suddenly we have this massive jump, you have to question exactly how many deaths there have been. And remember, these deaths that have been reported, they're only people who have died in hospital. So it's not accounting for people who have potentially died at home. So we will continue to see calls, really, for more data to come out of China.
Right, and cause for concern for the international community as well as the rural areas of China is the Lunar New Year holidays being just around the corner, which means a lot of traveling is going to take place. Are they taking any precautions ahead of the holidays?
Yes, well, the focus really now is shifting away from the cities where healthcare is quite good in China and to the rural, local communities where it's a very different story. And in the next few weeks, it's already really started, this mass migration of people ahead of Lunar New Year. We expect a lot of people to go from the cities where they work out to the countryside, and unfortunately, they're going to bring the virus with them. So China is now focusing its efforts on really trying to bolster healthcare supplies, healthcare equipment, and also access to get people from the countryside if they are sick and need to go to hospital, get them from the countryside and out into the cities. They have also asked people to be careful, particularly to take care when they're going to see elderly relatives. This is the time for family, the Lunar New Year holidays. People travel, go and visit family and relatives for a large amount of time. So there's a lot of concern about the virus being passed on to them. And as just mentioned, they're the people most at risk at the moment. So the targeted announcements really are around rural communities at the moment, trying to bolster drug supplies, trying to ensure that they are ready for a potential wave of infections out in the countryside. And obviously, the healthcare system is struggling as it is. We continuously see images of hospitals overflowing. So it's going to be a crucial time now in the next few weeks for China.
All right, Adam Hancock live for us there in Singapore. Thank you for that.